Sandra, from your perspective, alcohol use in pregnancy, I remember it was a big issue when I was in the department and Jeremy Hunt was Secretary of State and did some important work on that with his then shadow, Mr. Ashworth. You'll remember that. How big a problem are we in 2024 on alcohol use in pregnancy in England?
Well, thank you for having us here at the table. The first FASD diagnosis was 50 years ago, and to the best of my knowledge, this is the first time that we're in this room speaking with you all about fetal alcohol spectrum disorder and the risks of alcohol in pregnancy. I think it's as important to listen to when you're thinking about trends, to listen to what's not being said as to what is being said. So traditionally, when you talk about alcohol in pregnancy, it's wrapped up in the chief medical officer's guidelines, and it's a subset of the discussion. But when it comes to talking about alcohol use in pregnancy, there's no safe time, no safe amount, no safe type of alcohol. So the kinds of trends that are being discussed here right now do not apply to alcohol in pregnancy, and we simply don't have the numbers right now, and it should be tracked better. There should be better data collection on this. We know that the 2010 infant feeding survey got to some of this, where it showed that 40% of women drank alcohol in pregnancy, and it was higher among more educated white women, professional white women. We know that the UK has the 4th highest rate of drinking alcohol in pregnancy in the world. That's ahead of Russia, for example. And we know that those figures are probably just the tip of the iceberg because of the way the questions are asked. So we're looking at a society where we've got about 77% of women drinking alcohol. We've got about 50% of pregnancies are unplanned. And we know that there's more than 40% of those pregnancies where alcohol is being used. We also know, we just did a survey over the weekend, where again, we've been doing this periodically, where we test the general public to see if they recognize the chief medical officer's guidance on alcohol use in pregnancy, and it came back still that 20% of the population don't know about it, and it's not being necessarily taught in the PHSE in schools. We have yet to see public campaigns from from industry, from government. Maggie Throop, then parliamentary undersecretary, had said there hadn't been any public health messaging on FASD. There's a great way to go still. And that's just the prevention of harm from alcohol-exposed pregnancy. But I'm here also to talk about the prevention of further harm from undiagnosed and unrecognized fetal alcohol spectrum disorder, and I assume we'll come back to that.
And we'll develop that more, but it's fascinating the point you make, which clearly your colleagues on the panel can't make.
Be tracking it. We all should be tracking it.
Well, they can't make because the Prime Minister's argument around smoking is that there is no safe level of smoking, whereas for some people there is a safe level of drinking. For the percentages that Mr. Lambert was talking about, for instance, there is no safe level of drinking for them either, but there is no safe level of drinking for pregnant women, which is the point that you make, and you make well. Okay, let's bring in